Good morning, all. Thank you for joining today's broadcast. My name is Kate Kirley. I'm Director of Chronic Disease Prevention and Programs here at the American Medical Association. And in just a moment, my colleague Jennie Folk will get started with today's presentation on the AMA Prediabetes Quality Measure Set. After she wraps, we'll both be taking any questions you may have live. If you would like to submit a question for us to address, you can do so in the Q&A box beside this video player. If you are watching this stream on YouTube, you will need to follow the link in the description in order to access the Q&A box on the AMA Ed Hub. I look forward to hearing your questions in just a few minutes, but until then, here's my colleague, Jennie Folk.
Hello, everyone. My name is Jennie Folk, and I'm a Senior Program Manager at the American Medical Association. Thank you for giving me this opportunity to share the AMA prediabetes quality measures with you all. Today, I'll be reviewing the background on the measure set and our vision, and then I'll dive into each quality measure with a description of the denominators, exclusions, and the numerators. This webinar is supported by Cooperative Agreement number OT18-1802, Strengthening Public Health Systems and Services through National Partnerships to Improve and Protect Nations' Health, funded by the Centers for Disease Control and Prevention. Its contents are solely the responsibility of the authors and do not represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. A quick background on the measure set. AMA partnered with CDC to improve type 2 diabetes prevention, including increased referrals to the CDC National Diabetes Prevention Program or the National DPP Lifestyle Change Program. During this time, AMA was working directly with healthcare organizations to plan and implement a diabetes prevention strategy. We found that healthcare organizations had a difficult time prioritizing type 2 diabetes prevention, partially because there wasn't a generally accepted method to track progress, and there wasn't an existing incentive to do so. As a result of this, AMA began to develop the prediabetes quality measure set. Work on the measure set started in 2017, and in 2020, we applied to the National Quality Forum, or NQF, for measure endorsement, and to the Centers for Medicare and Medicaid Services, or CMS, for adoption into the Merit-Based Incentive Performance System, otherwise known as MIPS. Unfortunately, we were not successful at that time. We then began to redefine the measures with a new measure developer, the Health Services Advisory Group, in 2021. The measures were updated based on the revised U.S. Preventive Services Task Force, USPSTF, and the American Diabetes Association guidelines, the feedback we received during the previous endorsement and adoption process, and recommendations from our technical expert panel, or TEP. The TEP was made up of a group of representatives from stakeholder organizations, guideline developers, quality measure experts, clinical operations, and subject matter experts, as well as patients and caregivers. These are the quality measures we'll be reviewing today. Our vision for this measure set is that it will lead to improved health outcomes by serving as a means of both assessing and incentivizing high-quality diabetes preventive care. The current measure set includes 3 measures, all developed as electronic clinical quality measures, or eCQMs. The first 2 are process measures and include screening for abnormal glucose and type 2 diabetes prevention interventions. The last measure, type 2 diabetes prevention for high-risk patients, is an outcomes measure. The first measure, screening, is a percentage of adult patients with risk factors for type 2 diabetes who are due for glycemic screening and for whom the screening process was initiated during the measurement period. Our measure testing indicated there is a large performance gap here. Screening rates at the testing sites were low. The denominator is all patients who had at least 2 office visits or 1 preventative visit during the measurement period and have risk factors for type 2 diabetes. There are 2 risk factors. The first is having a body mass index, or BMI, of 25 or greater, or a BMI of 23 or greater if the patient reports Asian origin. And the second is being between the ages of 35 and 70. This age range is consistent with the USPSTF recommendation. There are several denominator exclusions, including pregnancy during the measurement period, or a diagnosis of advanced illness or limited life expectancy where screening for prediabetes would be inappropriate, or a diagnosis of diabetes or a diagnosis of prediabetes during the 2-year look-back period. This measure is focused on screening patients who are not already diagnosed with prediabetes. And finally, we are excluding patients with a screening test performed during the 2-year look-back period. We don't want to encourage overscreening, and the acceptable time frame to rescreen patients not diagnosed with prediabetes or diabetes is generally 3 years. The numerator of this measure is the number of patients who had a screening test performed and results documented during the measurement period. There are 3 glycemic screening tests included in this measure: fasting plasma glucose, glucose tolerance test, and hemoglobin A1C. Moving on to the intervention measure. This is the percent of adult patients identified as high risk for developing type 2 diabetes who were offered a diabetes prevention intervention during the measurement period. The intervention measure stems from the screening measure, in that the initial population for the intervention measure is comprised of patients who had a glycemic screening test completed, which is the screening measure, and whose lab value was in the prediabetes range. So this measure is then the percentage of people with a lab value in the prediabetes range who were offered an intervention. The denominator of the intervention is similar to that of the screening measure, and that it includes all patients who had at least 2 office visits or 1 preventative visit during the measurement year, and who have 2 of the same risk factors, BMI and age. Lastly, all patients in the denominator must have had a glycemic screening test result in the prediabetes range during the measurement period. There are several denominator exclusions for the intervention measure. Most are the same as the screening measure: pregnancy, or a diagnosis of advanced illness or limited life expectancy, or a diagnosis of diabetes or a diagnosis of prediabetes during the 2-year look-back period, or patients with a glycemic screening test performed during the 2-year look-back period. This measure also excludes patients who already had a referral or documentation to an intervention prior to the measurement year, and it excludes patients already taking metformin. This measure also has a denominator exception, which is a reason for not referring a patient to an intervention. This could include a patient's refusal or a valid medical reason. The numerator of the intervention measure is made up of patients from the denominator who were provided an intervention during the measurement year. The interventions are grouped into 2 categories: intensive lifestyle interventions and a prescription for metformin. Intensive lifestyle interventions include behavioral counseling for obesity, diabetes education, National DPP Lifestyle Change Program, diabetes self-management education and support services, dietitian referral or visit, medical nutrition therapy, and weight management or nutrition classes. And the final measure is diabetes prevention for high-risk patients. This is an outcome measure, and it is the percentage of adult patients who are identified as high risk for developing type 2 diabetes in the 2 years prior to the measurement period who did not receive a diagnosis of type 2 diabetes during the measurement period. This is essentially the percentage of patients who were at risk for developing type 2 diabetes who did not progress to diabetes during the measurement period. Similar to the other 2 measures, a higher percentage is better. The denominator of this measure is similar to the previous 2 with a few differences. It includes all patients with at least 1 office visit or preventive visit during the measurement year, and at least 1 office visit or preventive visit during the 2-year look-back period. The risk factors for diabetes are the same: BMI and age. And patients must meet one of the following two criteria: a diagnosis of prediabetes during the 2-year look-back period, or a glycemic test result in the prediabetes range during the 2-year look-back period. There are 3 exclusions, all similar to the previous measures exclusions: pregnancy, a diagnosis of advanced illness or limited life expectancy, or a diagnosis of diabetes during the 2-year look-back period. The numerator is made up of patients from the denominator who did not receive a type 2 diabetes diagnosis during the measurement period. So those are the 3 measures that make up the AMA prediabetes quality measure set. All of the measures have been finalized as eCQMs using EHR data. We will be using them within our own QI program, and we're also licensing the measure set for free to most organizations. If you are interested in reading the measure descriptions, which include specific guidelines and rationale, please go to the webpage listed on screen to download the document. This same website also houses the full specifications, which are available for free to non-commercial entities like healthcare organizations. For licensing information, follow the directions listed on the webpage.
I think that was a fantastic introduction to the AMA prediabetes quality measures, Jenny. Thank you for that. So let's get started with questions from our audience. And as a reminder, if you are in the audience and you would like to ask a question, please feel free to put it into that Q&A box that's located on your video player. And again, as a reminder, if you're watching on YouTube, follow the link in the description to go to the AMA Ed Hub to ask your question. And for now, initially, we'll get started with several questions that have already been submitted. Jenny, I think you have one teed up already.
Yes, I do. We're actually going to start with a question that hasn't yet been asked, but inevitably it will. And this question is, will the slides be made available? The answer to that is yes, they will. The slides have been made available in the resource tab above the video player. And then we'll remind you about this at the end of our presentation. So the first question that was submitted to us prior to today's webinar is, how can medical assistants educate their patients more on this topic? And I'm going to hand off to Kate to answer that question.
Yeah, medical assistants are such an important member of our care teams and can really expand our diabetes prevention efforts. So they are great individuals to ensure that our patients understand what they need to do to get their screening tests that we order. They're great individuals to help our patients get connected to the diabetes prevention programs or other interventions that we refer them to. They can also do some very brief counseling or share materials with patients about lifestyle interventions and healthy lifestyle changes. So I think there's a number of ways that you can get your medical assistants involved in your diabetes prevention efforts. Um, Jenny, I think one question we've gotten many times as we have spoken about this quality measure set is, how do we recommend that people get started with building the quality measure set?
This is also a great question. And the simplest answer to that is just get started by going to the webpage, which we'll put in the chat, and downloading the measure descriptions. So this is a document that includes everything that was presented today. It includes your initial population, your denominator, your numerator, the exclusions, but it also includes rationale, and it includes some of the codes that define what a glucose screening test is. This is really your starting point. From here, it's best to have some initial conversations with IT. The measures are specified in a similar fashion to other quality measures, so it shouldn't be surprising their format, but it does take time, it does take resources to build these measures. So it's best to have those conversations early, and include everyone that's needed to build those measures in those early conversations. But really, your next step, if you're interested, is to go to the webpage and download those measures, and just read through them again, and especially the rationale. So we have another question that came in. I'm going to ask this one to Kate, and this is, do you still recommend prescribing metformin to treat prediabetes?
Metformin is one of the prediabetes treatment options currently recommended by both the US PSTF, so the United States Preventive Services Task Force, which is really the set of clinical recommendations that the quality measure set is based off of. Metformin's also on the list of treatment recommendations recommended by the American Diabetes Association. So the two primary treatment options available for diabetes prevention are intensive lifestyle interventions. So that includes things like the diabetes prevention program. But metformin also has good quality evidence demonstrating its effectiveness for reducing someone's risk to progress on to develop type 2 diabetes, and it's appropriate for many of our patients. So I think another question that we have seen before, Jenny, this is more of a technical question. Why does the screening measure exclude patients who have had glycemic screening during the 2 years prior to the measurement period?
When we developed the measure set, one of the things we were careful to do was to not encourage overscreening or not encourage additional care that wasn't necessary. And the generally acceptable time frame for screening patients who have not already been diagnosed with diabetes or prediabetes is generally 3 years. So we've excluded patients who have had a screening completed in the 2 years prior to the measurement period, and then you add that 1 year of the measurement period, and that's your 3 years. So it really comes down to not wanting to encourage overscreening. But another important part of this is that if a physician feels that it's necessary to screen a patient, um, and it's within that 3-year time frame, this doesn't mean that the physician shouldn't use their best judgment and do so. What it means is that this patient won't be included in the measure set or in the results of the measures. I'm looking for additional questions. So for Kate, I have a question for you, and it is, why is the age range 35 to 70? Does it not pertain to patients under 35 or over 70 years old?
Yeah, this goes back to, like I mentioned before, we based the clinical aspects of this measure off of the current United States Preventive Services Task Force recommendation for abnormal glucose screening. So that USPS-TF recommendation that was updated. Oh, now I'm forgetting if it was last year or the year before. It feels so recent to me, but it was recently updated. And one of the new things about that recommendation is that they adjusted the age range that where they recommend screening and intervention to age 35 to 70. So again, like Jenny said before, that doesn't mean that a clinician should not use their own judgment regarding who they want to screen. There are certain people who may be at higher risk for developing abnormal glucose earlier in life at a younger age. This may include people who have a significant family history of type 2 diabetes, people who had gestational diabetes. These are examples of individuals who may be at higher risk for developing type 2 diabetes at a younger age. So it may be appropriate to screen those individuals earlier. It's just that those individuals will not be captured in this measure. This measure really does focus on the population of patients with that clear grade B recommendation from the USPSTF. So I know we're also getting some questions coming in the chat. I think one of those questions was, has CMS included this measure in MIPS? And is this a goal for AMA? Jenny, I don't know. Do you want to start that one? I can chime in too as needed.
I'm going to let you answer that question.
It is not. This is something that AMA is very interested in. We are hoping to get this measure or this measure set eventually included in MIPS or other CMS programs. We are not expecting it to be included in 2024 or 2025, but this is something that we have been advocating for and we will continue to advocate for. We think that diabetes prevention is a really important issue for all populations, including the Medicare population and including for physicians who are part of the MIPS program. But unfortunately, we don't yet expect any of these measures to be included within MIPS. And we're just going to do a quick check to see if any other questions are coming in the chat. We'll give everybody another minute. If you have another question you want to submit, we're happy to answer it. Jenny, I think you wanted to share some information as well
I
about who people
do.
should contact. Yeah.
I do. So I am like many people watching this webinar that the second you you hang up the webinar, you say you don't have any more questions, you think of one. So if you do have a question after today's webinar, there is an email address for you all to email with your questions, and it is ama.iho.qualitymeasures@ama-assn.org. Email us here. I'm the one who will get those emails, and we will answer those as soon as we can. So any questions that you have, big or small, we're available to help you out with those.
Yep, we would love to see different practices and healthcare organizations adopt these measures, and we're happy to help. So I think with that, I'm going to say thank you so much to everybody for joining us today. Jenny and I really enjoyed this time, as brief as it was. You will find a link to the deck that we used today in the resources tab above the video player. And again, for additional resources to support your physicians and staff, please visit the AMA website or stepsforward.org. And again, below this video player, you will see a link to a really brief 3-question survey. We ask you to take just a minute to fill that survey out, as your responses there really do help guide us with our upcoming programming. And thank you again, everybody.